I can't work out. I can't lift weights. It's just too painful. I've been told that this is the way I have to live. I can't even get out of bed, you know, to feed myself. I remember in 2015, I took all the meds. I lived like I was in a cloud. I lived like I was in this bubble and everything was slow motion, and I even had thoughts of running my car into a telephone pole. I didn't even feel anything. Oh my God, I can touch my paw. I think I've ever been able to do that. It doesn't even hurt. Like I feel like you've given me like a new start.
We have Rosario here. She's nervous as can be. She's taking deep breaths. I don't know if you guys can hear it, but she's taking deep breaths. But you are going through a lot of things, right? Tell me what is bothering you, what's hurting you, what is the toughest thing going on right now?
My main concern is my neck. It always hurts, and it's like the right side of my body. So I get a lot of tingling, and then like my fingers numb, and it's always like my right side, and then like I get like numbness here and tingling.
Everything on that right side.
Yeah, I do like acupuncture, I've done massages, and it does feel better temporarily. The massage is like I get the deep tissue and the fascia massage, which works wonderful. Yeah. Temporarily. My neck always hurts. Like I can't work out. I can't lift weights, I can walk. That's about the only exercise that I could really do. And even like if I do yard work, I'll be like, okay, but then I suffer the consequences. So if I want to do yard work and I feel okay to do it, but then I'm down for like the next 3 days.
Oh my gosh. Things that aren't strenuous at all are just killing you. Now, when you say you're down for 3 days, what do you feel? What does that mean to you?
No energy. Everything is just like hard to do. Everything hurts. Even sometimes like getting dressed, like bending over and putting my socks on or my shoes, is just too painful.
I can just kind of tell from, you know, your voice and the way you're talking about it that it's really impacting you a lot. I know you got in a car accident in 2006. Is that when everything started, or when did everything start for you?
I can't remember, but I know that when I was in the car accident, it took me like a year.
It's okay, take your time.
Like to recover. And then I got pregnant in 2008, and it just seems like I never recovered from that. I had a really hard pregnancy, and I was bedridden for like my last 3 months.
Oh my gosh.
And it just seems like I never, it took them years to diagnose me with fibromyalgia and other stuff. And so recently I was in the hospital at the end of July because I had like pain in my hips, and so they just gave me pain meds and sent me home, said it was inflammation. And that's just kind of been the story throughout the years. Like it's been over 15 years. Yeah. And my doctor took x-rays of my hips, and she says you have arthritis and inflammation in your hips. And so my neck, they've told me I have arthritis in my neck and my back, and that's just kind of been, I've been told that this is the way I have to live.
I don't believe that. I think someone telling you that this is the way that you have to live and this is it, I think they've just kind of given up. And I think sometimes when you go to these different physicians or you go to these different doctors, I kind of hate to say this, but it's like since they don't know what to do with you, they're just going to diagnose you with something and say, that's it, sorry, wipe their hands clean, see you later, which it pisses me off. Just because I've seen so many people come through here that have said the same thing, and it seems like, you know, we're like your last ditch effort right now.
That's like where I'm at, because like I've had a lot of people, you know, even say like, that's gonna be temporary, or like, that's a lot of money, or like, you don't know. You're like my last hope, because I see your videos and I see people, you know, and so that's why I'm here. As nervous as I am and scared, that's why I'm here, because I'm hoping that like, this is gonna help me.
You know, I believe that people that take steps of faith get rewarded. I think sometimes getting past the whole point of fear, past the nervousness, and you know, you start just not even, how do I put it, you don't even leave it in your hands anymore. You're just like, God, I hope this works, and you just kind of guess. But that's really what faith is you're taking steps without knowing the outcome, and sometimes you can be absolutely rewarded for just doing that, right? So this is going to be great for you. I think it's going to be something incredible, and I think we're going to get you better. So let's do a few checks on you here. So look straight. And I'm gonna pull this back. I can just hear the pain in your voice, and I can hear how rough it's kind of been. And you know, I think this is gonna be awesome. Let's have you look straight towards Kevin over there and turn your head all the way to the right. Does that hurt when you do that?
I feel a strain.
Okay. So what we're noticing here, nose is like this. It's about 60 degrees, and we want to be closer to 90 this way. Look to the left. Is that easier or harder for you?
This side's easier always.
That side, yeah, it looks like it. Look straight. Let's have you look all the way up to the ceiling. That hurts? I can see your eyes fluttering. Look all the way down. Does that hurt?
No.
Okay. Look straight. Stand up now for me too. Let's have you try and touch your toes.
Okay, now turn your neck, move it around.
Does that hurt?
It's tight.
Okay. Come back up. Now when you say it's tight, is it tight in the lower back? Is it on the left side, right side, your neck? All your neck.
Like my spine.
Wow, okay. Let's have you drop down to your right side like that. Does that hurt?
Yes.
Okay. On your right side or the left side?
The left.
On your neck?
Yeah.
Interesting.
Like here.
Okay. Go down to your left side. Pain there too?
Yeah, and this one hurts all the way down, like
Okay.
the ribs.
So I already know it's going to take a little bit of work because these tests are for your back. But if you can't even bend over this side and your neck's hurting, the whole system is just in a bad dysfunction right now. Let's go face down into the table two. Keep the left leg straight for me. Lift your left leg up as high as you can go.
Left leg?
Left leg, yep. Painful? Does it hurt?
It doesn't hurt, it just feels so tight, like somebody's pushing it back.
Okay, go back down. It's like you've reached the ceiling, huh?
Oh yeah, like right here it does hurt.
Gotcha. Do the right side. Does that hurt?
I feel so tight, yes.
Okay. So what I'm noticing here is that you have this pretty big hyperkyphotic curve in this upper back here. This might be what's causing what's going on down here and what's causing up here. So we're gonna definitely loosen up a lot of this here first, okay? When you're lifting these legs up and you're hitting that ceiling, this is where it's coming from. So I'm gonna push just like this. You feel that stretch? Does that hurt at all?
Yes.
Yep. So we're gonna give you a few pumps and pushes here.
Oh my gosh.
Oh, that pop already, huh?
Yes.
When a doctor gives you fibromyalgia, do you know what that means?
It means a whole lot of baloney.
What did you say? A whole lot of what?
Baloney.
Baloney? that's pretty much right. So fibromyalgia is just a fancy way of saying I don't know. That's really what it is. Table's gonna pop up underneath of you, okay?
Okay.
You all right?
Yeah.
Okay. All we're doing, we're pressing in this rib actually, like this, just like that. Good. Lift the left leg up again. How does that feel?
It feels better. It
Good.
feels tight.
Do the right side. So we're looking for marginal improvements first. That looks a little bit better.
Yeah, it feels better.
Just do a little bit in through there.
Right there.
Down in there, yep. We're gonna go just like that. Good. Good. Lay on your back for me. How do you feel right now? A little easier?
Yeah.
Still just as nervous? You warming up to me a little bit?
Yeah, but I feel shaky still.
Shaky, nervous-wise?
Yeah.
Okay. So the shakiness might not even be you being nervous. So we've already started to change some things in you. So the shaking can just be your body just kind of going in a little bit of shock right now because it's we just unlocked something already. All right? Ready? All right. It's nice and easy. How many videos have you watched?
Lots.
Lots. Deep breath in through your nose, out through your nose. Keep your lips and teeth together. I'll tell you a little joke. There was a couple here, not here, but in Houston, and the wife was on the table and the husband was back there. They were an old couple. And I said, keep your lips together, teeth together. I don't want a tongue coming at me. And he was like, that wouldn't be the worst thing in the world. It'll like your fingers for me. That'll be better. It'll like your fingers. That's good. Here. Breathe, 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 breathe. I know that was a lot. Just let it out.
Wow.
Yeah, that was a lot.
That came from everywhere. Like I felt it in the front, in the back, in the lower back.
It's a huge release. Huge. Gonna let your body just kind of process through it a little bit. That was an instant, like, tears coming out. What do you think made you so emotional with that adjustment?
I just felt like relief. Like I don't feel that tightness. I think the hardest part for me always has been that there's always been something wrong and I don't know what it is. And like people don't believe you. Even the doctors, like I had this one doctor said, there's nothing I could do for you. You have chronic pain, like how you have to live your life. Like I don't know what to do with you. And I remember leaving her office just feeling like so bad.
Felt defeated.
I feel like I always have to prove and explain the way I'm feeling. I can never explain, like just feel so terrible. That pressure in my back and my, like it's not there right now. Like,
let's go.
I don't even know what this feels, I like.
This is normal.
This is new, like I don't even know. That tightness isn't there. I don't know when the last time it wasn't there.
That's a huge statement. I mean, you know, when do you feel like the last time you actually felt normal was?
I don't know. I had to be in my 30s.
So I've had my own issues as well too, and I always felt like I had to not only tell the doctors like I'm not lying to you, but then I had to validate it to myself too, because it makes you think that you're crazy.
Yeah.
It makes you legitimately makes you think that you're crazy, that you have to continue to explain to somebody that there's something wrong with me, but then they say there's nothing wrong with you. Your spine looks fine, everything looks fine. You know, you just have pain. Well, what the hell are you gonna do to help me out, right? And you get in the cycle of prescriptions and whatnot, and I think it makes me upset whenever I hear like there's nothing we can do for you. Here, you don't have to validate. Like I believed you the first time you told me you're in pain.
I get a lot of issues with doctors that I see. I've been to pain specialists and they want you to take all these meds. I took the meds. I remember in 2015, I took all the meds. I lived like I was in a cloud. Like I lived like I was in this bubble and everything was slow motion. And I even had thoughts of running my car into a telephone pole and the doctor said, get off the meds. Yeah. And so I'm afraid of taking the meds now because of that. And I get a lot. One doctor said, if you won't take the meds, I can't help you. And like a pain doctor, that's your last resort because that's the person that's supposed to help you. And he's turning you away because you won't take the medication. But I know what the medication does. I'm in control, at least, if I'm not on the med. And it's been really hard.
That's heavy. That's really, really heavy. I mean, gosh, I can't imagine. I mean, I know that on your chart you put that you went through some depression and whatnot because of this pain. And I guess just imagining like to hear that and being in your position and then hearing that I'm not going to help you because you're not taking any of the meds, that was making me more depressed. And they don't give you an alternative solution. Well, I'm glad you're here.
I am too. Like I can never lay on my back flat. And I like my shoulders, like the mid back, I don't even feel it's there.
You good?
I can't even get out of bed, you know, to feed myself or, you know, and they're not dizzy spells, but I get this tightness on the right side of my body where it's almost like vertigo, but not vertigo. And I don't know how to explain it to people. And even the doctor, she gave me medication for vertigo. How
many medications do you think you were on at the peak of everything?
I have my own pharmacy.
No more, yeah? Let's set you up. Let me grab you 1, 2, 3, that way. I will say though, like, good on you for knowing like how it was actually affecting you and how the medications were affecting you and just saying like, no, I'm not gonna do that. There was a similar situation in my life where I was like, I'm not gonna do that because it makes me feel like a zombie. And I just felt like I was just floating through life and I was like, I can't be like this for the rest of my life. This is ridiculous. So now we're switching gears and I'm gonna be placing this here first. So I'm doing things here that are gonna help you out, but this is gonna be kind of tender.
Yeah, you know, my arms hurt. My arms are always hurt, like right here.
Right through there? Okay. So this is a rib, first rib. Comes out and it'll just hurt a lot. Good. How many kids do you have?
4.
4.
3 of them are here.
How old's the oldest? You're the oldest? 21? Yeah. Okay, good. Yeah. 21. Good. All right. Look straight again. Turn your head to the right again. It's even better, right?
Yeah, but my arm hurts down.
It's okay. Look to the left. Yeah. We're gonna split the hair here and look all the way up. So having the tightness in the shoulders and whatnot also comes from that mid-back. So when that mid-back is stiff, right, this part here, and your body's collapsing this way, it pulls these shoulders in like this. What I'm gonna do first is just kind of get you some motion this way. Not a lot. Just doing this first. You guys aren't driving back today, right?
Yeah.
Oh, you are? Well.
She is.
How old are your brothers?
26. 25 and 15.
He's old enough now?
No.
No? You're not allowed. Lay back on your stomach now for me. So I need to see how your body's just kind of taking this. Ooh, that is not. All right, see how like this one you can kind of pull a little bit? This one's like not moving at all. So we're gonna open this heel and open all the way up top. Good. You okay? Yeah. All right. Relax that hip a little bit more. More. Breathe. Deep breath in. Exhale out. In. There it is. Lift the left leg up again.
My body's shaking.
It's okay. Good. Better?
Yeah.
Right side. Way better, yeah?
Yeah.
We're gonna press in this area. So that shoulder that you're feeling, a lot of it's coming from this area here. And what we need to do is just really open this. So we're waiting for your whole body to get into that tension point right in there. Good, that's tough. I'm gonna pull it the other way. We're gonna go this way. Let your whole body relax more. So there's a lot of stiffness in here. Bend over. Yeah, good. Nice and easy here. Good. So I'm gonna really get this to open up some more, okay? So right up top, right in there, we're pushing in. There it is. Good. And left leg all the way up again. Beautiful. Right side. Beautiful. Good. How does that feel?
Easy.
That was pretty emphatic. I'll take it. Lay on your side. Face me this way. And I want you to relax everything. Beautiful right there. You can feel that. We're going to roll in. And I just have to push in. Beautiful. Yeah. Feel good? Good. Other side. Let this twist. Lower part on that right. Let this relax. Good. Really working. Oh. Yeah, wow.
Okay. I'm not shaking anymore.
We just took the shakes out real quick. Look at that smile though. It's like really, you look like you're like actually relaxed. Let's have you on your back. So we're gonna get right under here. You're gonna keep your head tucked like that, okay? And what you're gonna do is lean back 1 second right there, okay? Keep your head tucked, okay? And let your shoulders first relax. That's it. Good. Nice and easy. Breathe, breathe. Exhale. Let the head relax back now. Good. Oh, yeah. Yeah?
That feels good. I thought it was going to hurt. It doesn't hurt at all.
No? She was really nervous coming in. Definitely. I had her come in here and she was just like, I don't know what to do. Want to hear a joke? You know why it's okay to be nervous? Because we're dealing with your nervous system. Sit up now for me too. That's great. And let's have you tilt your chin down for me. Just want to see that. Okay. Deep breath in. Exhale out. Roll back. All the way back. Even your chin. There it is. That was beautiful.
Like, I think that's where it was.
That's what I was trying to get earlier, but your body wasn't letting me, and I had to get the other one first.
That was it. I cannot feel my back. Wow.
How often are you getting headaches?
I wake up with a headache.
You wake up with a headache.
I wake up with a neck ache and a headache.
You just wake up with an ache.
Yeah,
How many years?
too long. My little one out there's 15, so before he was born.
You said like after you had him, it was too tough, right?
Yeah.
So it's his fault.
No, no. I wasn't aware though. I always say I never recovered from my pregnancy, but it was the car accident in 2006.
Yeah.
It took me, like I had lost range of motion, but it doesn't make sense to me because my right side's the one that gives me the problem. Like I couldn't feel my arm. It took me like 6 months to go back to work.
Now, because of the pain, you haven't worked in a while either, right?
No, people didn't understand when I quit my job in 2015. Everybody was like, why are you quitting? I couldn't even get to work, let alone I was hiding, I was missing more work. I couldn't do it.
I was asking her if she wanted to work after. She said, yeah.
I don't want to do retail, I know that.
So we're getting right where her atlas is, which is right underneath. Lean back towards his hand. That's good, okay. So I'm gonna take your head into different positions, okay? So turn more all the way, better. Good, let your head come down into this hand more. You okay? Loosen your chest more, it's a little too tight. Kind of fold your head more into this hand. There it is. Nice and easy. Take deep breaths.
Oh, my ears opened up.
Now when I press here, you see how much looser that side is?
I have like tightness and like this side feels.
So that's the next side we're gonna get, okay? And we're resetting this upper cervical area because of how much that controls. So there's so much, like your brain stems in there, which controls your energy, controls your focus, sleeping habits, and just kind of everything. Turn this way more. So I want you to feel like looseness. Yeah, there it is. You okay?
I hear crunchies on this side, but I feel like my eyes are not heavy. I feel like my eyes are open.
Your eyes don't look like mine anymore. Deep breath in through your nose, out through your mouth. Good, loosen the chest. I can feel that mid-back kind of tightening. Deep breath in again. Exhale all the way out. All the air out, all the air out. Good. I'm waiting till you have like a really good relaxation to show you. Deep breath in and let the muscles, the whole neck, just let it expand like an accordion outwards. Good. That's okay, good.
That felt like a car accident. Oh my goodness, this opened too.
Yeah. A car accident in a controlled good way.
Oh. I felt it down my legs, even like on the front of my legs.
What are you feeling through your body right now?
I feel light. I can't explain it. I haven't felt like this in a long time.
This is how you're going to be feeling more for a long time. And I will switch the rest of it.
Even like when I walk and sit, the top of my right ankle, it's like the top of my foot always feels tight, like it never fits in my shoe. Feels good.
Feels pretty good. I'm gonna take off your shoes, okay? Let's see how the ankles are. Yeah, a little tight on this side, okay? I'm gonna. All right, so let's open up this heel a little bit more, just like that. Good. You all right? Good. Good. And then let's check that out again. See that? Better, right? And then here, loosen. There it is.
Oh, wow.
Beautiful. All right. Ready? Good. Also getting a little bit more this way. Do this ankle thing too here. Okay, good. Awesome. Ready? Let's sit you up. And I'm going to use this on your neck again here, all the way up. All right. Recheck you now. Let's have you look to the right again.
That feels good.
That's like 100%. Look to the left. Yeah.
I don't even feel the pulling that I usually felt down my spine. And you know, I used to always feel like something in the back of my eye. I don't even feel that.
That's awesome.
It's crazy.
Let's have you look all the way up to the ceiling. That's way better.
I don't feel that pulling in my back.
Let's look down. Yeah. Move forward. Touch the toes. Wow, come on.
I didn't even feel
Oh my God, I can touch my paw.
Here.
I don't think I've ever been able to do that. It doesn't even hurt. I can't even put my underwear on sometimes because I can't get my leg up or bend over like that. I can't believe I touched.
I'm happy for you. That's, I mean,
That's amazing. Like,
yeah.
can I give you a hug?
Yeah, absolutely.
Thank you so much.
You're so welcome. You deserve this, honestly.
Thank you. Like, I feel like you've given me like a new start. I feel like was so much, and I knew I held on to a lot because I've been through a lot in my life. I've been on this wellness journey and have always like get so far and I always just feel stuck.
Yeah.
Stuck, and I just feel like a lot of that was released right now, and I'm just like, I know, stopping me now.
We're breaking through that ceiling that's just been capping you for so long now, and now you can.
Like, I don't even have pain in my hips or my leg. Is this my back? Somebody gave me a new back. I just can't explain it. I'm always burning. Some part of my body is always burning with tightness and pain. I still have the numbness in my thumb, but
That's okay.
that's okay.
Well, that's the only thing that's left. I mean, that's good. I want you to take advantage of this new you. You know, there's going to be your muscles have been this way for so long, and it's going to try and revert back. So we have to really make sure that we're fighting it. Walking backwards 10-15 minutes every day. I also have a stretch and exercise app that I'd like you to follow. That way you can continue to get your body moving. The block for your neck is going to be huge as well too. I'm also going to recommend one for your mid back, since you do have that pretty big arch. I think what we have to do is push this back more, so get that extended out even further. And the more that you do that, the better it just becomes.
Okay, I sleep on these Franklin balls.
Oh wow,
That's how I
because it
wake
hurts
up.
so much?
Yeah, because that's the
Wow.
only thing I feel like there's so much pressure, and when I sleep on these balls, like it'll release the tension, but I wake up and my son says, he calls them pepperonis, but that's the only way I can get relief.
Yeah, I understand like why that's happening. So put a pillow or two underneath of your legs so that it flattens your curve out a little bit more. So the reason why you're putting
under
it
here?
Yeah. So the reason why you're like, yeah, if you can sleep where you're like, if you put like your pillows like this,
Okay.
and it makes this flatter. The reason why you're placing it up and through here is because when you lay flat this way, this part is compressing and jamming again. So whenever you're able to take that slack out and make it a lot flatter, you don't experience it as much. You have to be very diligent with those blocks that we're gonna give you, right? Because your body absolutely needs to do it. We have to change that structure. So today we got the movement in. Demo day, we broke through a lot of this fixations. It's up to you now just to stay on it and keep on it, right? Because if you don't want to be like you were when you first came in,
don't.
you just have to do it.
Thank you.
That's
Thank you
awesome.
so much.
Yeah, you're so welcome.
Oh my God, I had to go get another. Thank you, thank you, thank you.